You hear a physiotherapist talking to a patient called Mrs. Evans. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon, Mrs. Evans. I understand you've been experiencing persistent knee pain. Could you start by describing your symptoms for me?
Yes, the pain has been ongoing for about 6 months now. It originally started as a dull, aching sensation that would occur after long walks, particularly when I was on my feet for extended periods. At first, it was something I could easily tolerate and would go away with rest. However, over time, the pain has worsened significantly. Recently, it has become much more intense and is no longer just a mild discomfort. Now, I often experience a sharp, stabbing pain, especially when I'm going up or down stairs, which can make it difficult to move freely. The pain seems to shoot through the area with every step, and it lingers for a while even after I've stopped walking. It's definitely much more severe than it used to be.
I see. Have you noticed any swelling or stiffness around the knee?
Yes, there's definitely some noticeable swelling, especially by the end of the day. It seems to get worse after I've been on my feet for long periods, or if I've been doing a lot of walking or standing. The swelling often makes the affected area feel tight and puffy, and it's quite uncomfortable. In addition to that, stiffness is another major issue I've been dealing with, particularly in the mornings. When I first wake up, the joint feels very stiff and almost locked in place. It takes me a while to loosen up, and I have to move slowly at first, stretching and gently getting things moving before I can move comfortably. This stiffness tends to improve as I go about my day, but it's always worse after a night of rest.
Have you had any injuries to this knee in the past?
About 5 years ago, I tore a ligament in my knee while playing tennis. It was a pretty serious injury at the time, and I remember feeling a sharp pain when it happened. I had to stop playing immediately, and it took a while before I could even walk properly again. After the injury, I underwent physical therapy and followed all the recommendations to make sure it healed correctly. Over time, the pain gradually subsided, and I thought everything had returned to normal. I felt confident that the ligament had healed completely because I was able to get back to playing tennis and other activities without any major issues. However, recently I've started noticing some discomfort again, which is making me wonder if the injury may have contributed to the current problems.
That's helpful to know. What activities aggravate the pain the most?
Aside from stairs, standing for long periods of time or walking on uneven surfaces really make it worse. When I have to stand for too long, especially without being able to move around, the pain intensifies and becomes almost unbearable. Similarly, walking on uneven surfaces like grass or cobblestones puts extra strain on the affected area and makes the discomfort more pronounced. The uneven ground seems to cause more instability, and I feel more pressure on the injured area with each step, which only aggravates the pain. Both of these activities have become more difficult to manage, and they really seem to worsen the symptoms.
And how does the pain affect your daily life?
It's very disruptive to my daily life. I've had to significantly cut back on exercise because the pain makes it difficult to engage in activities that I used to enjoy. Even simple tasks like going grocery shopping have become more challenging. I find myself struggling to carry bags or walk for long periods, and I have to take frequent breaks. It's not just physical tasks, either everyday things that I once did without thinking are now a lot more difficult. The most upsetting part is that I can't keep up with my grandchildren like I used to. I used to enjoy running around with them, playing games and going for walks, but now I find myself sitting on the sidelines watching them, which is really frustrating. It's been tough adjusting to these limitations.
I'm sorry to hear that. Have you tried any treatments or medications so far?
I've been taking over-the-counter painkillers, which do help a bit in managing the discomfort. They don't completely take the pain away, but they make it more bearable, especially when it flares up during the day. In addition to that, I've also tried icing the knee to reduce any swelling or inflammation, which sometimes provides a little relief. I apply the ice for about 15 to 20 minutes, a few times a day, but the effect seems temporary. I also started wearing a knee brace to provide some extra support and stability, especially when I'm walking or doing tasks that put pressure on the joint. While it does help to some extent, I haven't noticed a significant difference, and the pain still persists after a while. Despite trying these measures, the relief has been minimal, and I'm still struggling with the same issues.
Have you seen a doctor about this?
Yes, my GP suggested that I try physical therapy as a first step. They believe that targeted exercises and stretching might help strengthen the muscles around the joint, which could alleviate some of the pressure and reduce the pain. They also mentioned that physical therapy might help improve my mobility and overall function, making everyday activities easier. However, my GP also pointed out that if physical therapy doesn't provide enough relief, or if the pain continues to be disruptive, there's the possibility of trying an injection. This could be something like a corticosteroid injection, which could help reduce inflammation and provide longer-term pain relief. The GP emphasized that we would reassess the situation after a few weeks of therapy to determine whether an injection would be the next appropriate step. In the past.
That sounds like a reasonable plan. I'll design a tailored exercise program to strengthen the muscles around your knee and improve flexibility.
Thank you. I'm eager to try anything that could help.
You hear a nurse talking to a patient called Mr. Johnson. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon, Mr. Johnson. I understand you're here today because you're experiencing some shortness of breath. Could you tell me more about your symptoms?
Yes, it's been happening for about 2 weeks now, and it's been gradually getting worse. Initially, I only noticed a little shortness of breath after exercise, which I thought might just be due to pushing myself too hard. But recently, it's become more frequent and occurs even when I'm just walking around the house or going up a few stairs. It's as if I suddenly can't catch my breath, and I feel winded even during activities that wouldn't have caused me any trouble before. At times, it's a struggle to take a deep breath, and I feel like I'm not getting enough air, which leaves me feeling anxious and worried. I've never had anything like this happen before, and it's become quite concerning.
That must be concerning. Have you noticed any chest pain or tightness along with that?
No, there's no chest pain, thankfully, but I do experience breathlessness, which is the main issue. However, when the breathlessness occurs, I sometimes feel a slight tightness in my chest, as if it's harder to take a deep, full breath. It's not a sharp pain or anything, but more of a sensation that my chest is constricted or restricted in some way. This tightness makes it feel as though I can't fully expand my lungs, which makes the breathing issue even more uncomfortable. It's a bit unsettling because I can feel the pressure in my chest. Though it's not unbearable, it just adds to the difficulty of breathing properly during those episodes.
I see. Do you have any history of respiratory issues, like asthma or bronchitis?
I've had asthma in the past, but it's been well under control for many years now. I haven't had any major issues with it recently, and I haven't needed to use my inhaler for quite some time. In fact, I can't even remember the last time I had to reach for it. I've been able to manage my asthma symptoms with a good routine of med-avoiding triggers, and it hasn't interfered with my daily life in a long while. It's been such a non-issue that I almost forgot about it until these recent breathing problems started. Now, it's a bit concerning because this breathlessness feels different from the usual asthma flare-ups I've experienced before. I'm wondering if it's related to something else, or if my asthma is coming back in a different form.
Are there any factors that seem to make your symptoms worse?
Yes, it definitely seems to get worse when I'm exposed to cold air. If I step outside on a chilly day, or even just sit near an open window when it's cold, I immediately notice my breathing becomes more labored. It feels like the cold air makes it harder for me to take a deep breath, and I start feeling short of breath more quickly. Another thing I've noticed is that it's much worse when I'm lying down. I find it really difficult to breathe when I'm flat in bed, and it feels like my chest is more restricted. Sometimes I have to prop myself up with pillows just to make it easier to breathe, as lying flat makes it feel even harder to catch my breath. It's particularly uncomfortable at night, as I struggle to fall asleep because of this sensation.
Have you had any swelling in your legs or ankles, or noticed any fatigue or dizziness?
I've noticed some swelling in my ankles, particularly after I've been standing for a while. It gets worse toward the end of the day, and my ankles can feel quite puffy and uncomfortable. I've also been feeling much more tired than usual. It's not just the usual fatigue, I'm constantly feeling drained. Even after what I think should be a normal day, I can't seem to shake the tiredness, and it's been affecting my ability to get through my daily tasks. Simple activities that I never thought twice about now leave me exhausted. For example, just walking to the kitchen feels like more of an effort than it should. I get winded easily, and I feel short of breath after walking even a short distance. It's been frustrating because I used to be much more energetic, and now I feel like I'm constantly running on empty.
That sounds troubling. What about your medical history? Have you had any other health issues in the past?
I have high blood pressure and high cholesterol, both of which have been ongoing issues for quite some time. My doctors diagnosed me with high blood pressure a few years ago, and shortly after, they also discovered my cholesterol levels were high. Since then, I've been on medication for both conditions, and I've been sticking to the prescribed treatment plan. The blood pressure medication helps to keep things in check, and the cholesterol-lowering drugs have managed to lower my cholesterol to safer levels, though it's always something I need to monitor. I take these medications every day without fail, and I've been pretty consistent with my checkups to make sure my levels remain stable. It's been working for the most part, and while I do still have these conditions, the medications seem to help manage them and reduce the risk of complications.
That's helpful to know. How are you managing these conditions?
I take my blood pressure medication regularly, and my doctor recently increased my dose of statins for cholesterol. I'm trying to stick to a healthy diet, but I'm not always great about it.
Understood. We'll need to assess your heart and lung function, as these symptoms can be related to both respiratory and cardiovascular issues. I'll recommend some tests to help us figure out the cause.
I'm a bit worried about it, but I trust you'll help me get to the bottom of it.
Now that you're home after the surgery, it's important to follow the recovery plan we discussed. Make sure you avoid lifting heavy objects for at least 6 weeks, as it could strain your incision. Rest is crucial, but don't forget to take short walks daily to improve circulation.
Should I still take my medication, even if I don't feel pain?
Yes, pain relief is important, but the most crucial thing is to avoid lifting anything heavy. That's key to preventing complications.
I got it. So even if I rest all day, lifting heavy objects is off the table.
To get the best results from your recovery, we need to focus on building muscle strength. This will support your joint and prevent further injury.
I've noticed some stiffness. Should I work on flexibility too?
Flexibility exercises are helpful in general, and improving circulation through movement is also beneficial. But the priority now is strengthening those muscles to ensure stability.
Right, so muscle strength first, then maybe flexibility and better circulation later.
I've reviewed your test results, and I'm concerned about your blood pressure levels. They're significantly higher than they should be. This puts you at risk for complications like heart disease.
Oh no, I thought my cholesterol would be the main issue.
Your cholesterol is borderline and your weight is within a healthy range, but the blood pressure needs immediate attention.
So it's my blood pressure that I really need to address right now.
Looking at your eating habits, I'd recommend cutting back on fatty foods. These can contribute to high cholesterol and increase your risk of heart issues.
What about sugar? Should I be worried about that too?
Sugar intake is something to watch, and salty foods can also cause issues with blood pressure. But for now, reducing fatty foods is the most immediate priority.
All right, so focus on fats first and deal with sugar and salt later.
Extract 1, questions 31 to 36. You hear a presentation by a specialist cancer nurse called Sandra Morton, who's talking about her work with prostate cancer patients, including a man called Harry. You now have 90 seconds to read questions 31 to 36.
My name's Sandra Morton, and I'm a specialist cancer nurse helping cancer patients deal with their diagnosis and treatment. I'd like to tell you about the type of work I do, and particularly about one of my patients recently diagnosed with prostate cancer. Let's call him Harry, to illustrate the sort of things I get involved with. Now, before we get on to Harry, I'll give you a bit of background. Clearly, my job covers many aspects of patient care. But what's the priority? Firstly, prostate cancer is in fact the most common cancer in men in the U.S., with almost 300,000 new cases diagnosed every year. That's a staggering number. One problem is that this type of cancer actually develops very slowly, so there may be absolutely no sign that you have it for years. So if we're going to reduce the number of cases, it's vital that people like me get the word out to as many men as possible, that we tell them how to spot the signs of prostate cancer, like an increased need to urinate or straining while urinating, Unfortunately, the cancer can be at an advanced stage by the time patients come in for tests, at which point the available treatments are far less effective. So, let me tell you a bit more about my patient, Harry. Like many middle-aged men, Harry was offered a routine health check at his local doctor's office. As far as he was concerned, he had no particular health problems or obvious symptoms at the time, and so he almost ignored the invitation. But he'd promised his family he'd look after himself. His partner had died of skin cancer some years before, so he felt obliged to go. It was during his appointment that, based on a few symptoms he mentioned, Harry's doctor decided that he'd need further investigation for prostate cancer and referred him to a specialist clinic at the hospital. Harry's trip to the clinic started with a routine blood test, which initially showed a slightly low hemoglobin level. A further test then revealed that his PSA, the prostate-specific antigen, was high at 20. He then saw a urologist who conducted a digital rectal examination and biopsy, a procedure that I always try to explain to patients may be uncomfortable but is entirely necessary. In fact, though, Harry said the 3-week interval between having a biopsy taken and hearing the outcome was far more of an ordeal. Harry told me that when he went to see the urologist to get his results, he immediately sensed he was in trouble. Although the urologist was very considerate in delivering the news, unfortunately the indications were that Harry did indeed have prostate cancer. He was assured that the cancer was low-grade and not aggressive. Harry had suspected the worst, and though he'd tried to prepare himself for it by doing some online research, finally hearing that confirmation was still a shock. In fact, the very mention of the word sent Harry into panic, which was very unlike him. So at the time I first met him, he was very vulnerable and grateful to have someone to talk to. Of course, the response to the illness amongst prostate cancer patients like Harry can vary enormously. I've dealt with some men, for example, who haven't really realized the importance of keeping up their medication because they've felt relatively well, especially if they've been experiencing unwanted side effects. Unfortunately, though, any break gives the disease the perfect opportunity to spread into the bones, making it much more difficult to treat, and a successful outcome less likely. And some treatments do cause some unfortunate effects, such as erectile dysfunction, which some men really feel uncomfortable discussing because it's a sensitive issue. Other patients have mentioned that even though they've been given a lot of help, it's still difficult to weigh up the pros and cons of the various treatment options they're offered, from ultrasound or radiotherapy right through to radical prostatectomy. So responses like these need to be taken into account by specialist nurses when talking to patients. For me, these factors really underline the importance of the community follow-up clinics we have in my area, which address many of these issues in the provision of health care for cancer patients. Staff at these clinics see patients during their recovery and only send them back to hospital for treatment if they develop significant new symptoms. Seeing patients in the clinics means staff get to know each patient and build a relationship with them, which enables nurses like me to dispense advice and answer questions. And although we have no firm evidence, staff feel that's far more beneficial to patients than attending a large hospital clinic. So we're hoping more clinics like these can become available.
Now look at Extract 2. Extract 2, questions 37 to 42. You hear a neurologist called Dr. Frank Madison giving a presentation about the overuse of painkillers. You now have 90 seconds to read questions 37 to 42.
I'm Dr. Frank Madison, and I'm a neurologist with a special interest in the overuse of painkillers, particularly of opioids, something experts are now calling the silent epidemic. Now, we've all seen the stereotypical images of addicts hooked on recreational drugs, but addiction to painkillers like opioids has a much less familiar public face. From what I've seen, one reason for this is that the range of people affected makes them less easy to pigeonhole. I mean, there's no typical age, social class, and so on. And of course, most people seeking help for opioid overuse were initially prescribed the medication by their own doctors for pain relief. This highlights a major part of the problem. Physicians often pay little attention to the possible risk of addiction. They need to look carefully at patients' personal histories and assess the risk, considering things like depression and anxiety disorders, before prescribing opioids. In recent years, there's been a dramatic increase in opioid prescriptions. I see a pattern not just of GPs overprescribing, but of GPs inappropriately prescribing. Sure, people want their pain relieved immediately, that's understandable. But proper pain management requires lengthy face-to-face input, which time pressures don't allow, so easier alternatives have become the default option. What's more, although opioids can provide effective relief in the short term, they shouldn't be the automatic first-line therapy. Many alternatives do exist, and they're no more costly. People generally think of pain as a direct symptom of a problem in the affected area. But pain is an extremely complex subject, and it's one that used to be underrepresented in medical education. Thankfully, that's no longer the case, and doctors now realize that when a patient complains of acute back pain, that pain may not be due to a clear and treatable disease, but that such pain often presents in people with other medical problems, and these need investigation. Although there are distinct types of physical pain, all too often, I see sufferers lumped together in one category, which means that unfortunately, not all treatments are going to work equally well. For example, we first need to know, is the pain caused by inflammation as opposed to nerve damage? Establishing this makes initial mistreatment far less likely, meaning that treatment is more effective and the risks of long-term problems are reduced. But it's not just opioids we need to watch. Patients often self-treat with readily available painkillers like paracetamol. And while such drugs play an essential role in pain management, people still need to know more about them. We've been pretty successful in publicizing the dangers of accidental overdose, and clear information's given about the effects of taking these drugs long term, so public awareness about increased tolerance levels is also gradually improving. Many doctors also now actively warn patients about the spiral of taking higher and higher doses for pain relief. Worryingly, though, I've seen cases where people on drug regimes for other conditions inadvertently take painkillers which add a potentially hazardous ingredient to the mix already in their system. This is something which needs urgent attention. I'd like now to talk about an osteoarthritic patient who was referred to me, a 30-year-old woman, let's call her Anne, suffering from sarcoidosis, an autoimmune disease leading to chronic organ inflammation. She was prescribed various drugs, but though the disease was soon brought under control, the pain lingered, with Anne gradually becoming dependent on prescription opioids. Typically, she was terrified of stopping them, yet the more she took, the worse she felt. The thing is, her prescription would have been ideal for short-term pain, like that following surgery, but should never have been given for the chronic pain she was experiencing. And we all know that living with medication dependency has devastating consequences, not only on social well-being, but also on ability to function professionally, as was the case for Anne. She eventually went on long-term sick leave, as often happens in such cases. Thankfully, Anne's now much better, having recognized her dependence, and with the necessary support, tools and techniques, she's now off painkillers. The crucial thing is to prevent dependence in the first place. Anne's GP prescribed opioids in good faith, aiming at pain reduction, but failed to set an end date for these. He hadn't anticipated the possibility of eventual drug reliance, this being new territory to him. Anne couldn't hide the visible results of the quantities she was eventually taking, so her GP questioned her about intake. She reluctantly admitted supplementing her prescription from sources like friends and family, something her GP had suspected but hadn't investigated. Anne now realizes that drugs weren't fixing her problem, and though withdrawal took several tough months, her determination to succeed has paid dividends.